addition to Tier 1 and 2, it's just added on top of that. So students that are targeted in Tier 3 will also be doing individualized assessments and interventions tailored to their individual needs and frequent progress monitoring and referral for specially designed instruction if they need it. It includes a general education instruction along with interventions and monitoring by the SST. They may include an increased focus on individual instruction, mastery of content, like if they're struggling in a certain area, and progress monitoring. The interventions are recommended to normally last from 6 to 12 weeks, and the session should be 1 to 3 sessions per week for about 45 to 60 minutes. And a lot of it has to do with, is the instructor like efficient and effective for that child?
Tier 4, which is specifically designed learning. In addition to tiers 1 to 3, it targets students, targeted students participate in specialized programs, methodologies, or instruction deliveries. There's a greater frequency of progress monitoring and student response intervention. Basically, this tier, like if you are a student that is an ESOL, or a student that's gifted, or a student that's in special ed, I'm sorry, what?
No.
Oh, okay. Then you wouldn't have to go through the other tiers. You would just go, you would be straight into Tier 4. And so, talk about this more. Special education eligibility, and the required pre-referral process are intended to support the practice of providing high-quality instruction and intervention matched to the student's needs. So you want to make sure that the process is like the kids are going to be put like where they need it. It matches what they actually need. Matches student need, monitoring progress frequently, and to make decisions about changing in instruction and applying student response data to important education. So you're going to like monitor them, see what they need, and if they need more, you're going to like change it. Like this is where all the changes are, and like that's where the special education comes in. Gift education, the RtI process allows high achieving students access to, they have differentiated curriculum, so they may have like the same curriculum as like the other people on their 4th grade level, but they will be differentiated to be either more, probably a little bit more difficult than what their grade level is going to be on. Cluster grouping, which means that they'll kind of all stay together, and like they'll do different things with their cluster. Universal interventions available to all students in a regular classroom, so they'll be doing different things that the kids in a regular classroom will be doing. ESOL learners. English learners enter the pyramid at Tier 4, which is kind of what I was talking about. All 3 of these categories, they enter in at Tier 4 because they just go straight there. They don't have to go through 1, 2, and 3. And as the student progresses with language and development and academic proficiency, the level of interventions needed to support the student will decrease accordingly. So hopefully the purpose of ESOL is to get the kids to be able to speak English more clearly. So hopefully they'll be able to, I guess, eventually get out of Tier 4 because they'll be able to speak so clearly. When you're implementing Tier 4 interventions, here's some questions you are to ask. Are only those students who need specially designed instruction by specially trained teachers placed in specialized programs? Are data collection and progress monitoring clearly defined? Are goals for students clearly defined and measurable? You want to make sure that like the goals you're doing, like when we're doing our lessons plans, like your goals have to be measurable. You have to be able to test it that they're actually making progress. Are services and methodology distinctly different from those routinely provided in the general education environment? Is consideration given to ensuring placement in the least restrictive environment? And who is responsible for delivering, monitoring, and reporting the interventions? So these are all things you want to keep in mind when you're working with Tier 4 students.
Okay. How does this apply to us as teachers? Yeah, totally weird.
Did it?
Yeah. Classroom teachers play a pretty big part of this. They have to implement the CCGPS and GPS. And they're pretty much the ones that implement material different from what I saw. They have to consistently use formative and summative assessments to guide classroom instruction. Differentiated instruction is the heart of teaching and learning. Consistently communicate with intervention and instructional specialists, which is special education teachers, administrators, parents, sometimes psychologists. It was created to prevent students from being inappropriately referred to special education. And it's a process where teachers work with special education teachers, administrators, parents, and sometimes psychologists to tweak their instruction by providing necessary supports and interventions at increasing levels of intensity to help students who are just falling behind their benchmark. It is important because it prevents the rapid decay of learning desire that comes when a student senses it may be impossible to catch up with the class. And once a student is placed in the appropriate tier, the teacher is to keep on going assessments on the student to keep watch for improvement or lack of improvement. Decisions made on the student's instructional needs will be based on the data received from the assessments given. And then I found on this website what RtI does and what RtI doesn't. It develops a systematic way of identifying students' strengths and weaknesses. It reduces the time students wait to receive necessary instruction and intervention. It requires schools to ensure that underachievement is not due to a lack of appropriate instruction. It requires close monitoring and documentation of student responses to research-based instruction in general education classrooms, so schools are less likely to label students too quickly. It requires that general and special education classrooms share responsibilities to ensure that all students can receive additional support using a seamless instructional system. It requires the use of research-validated practices in core classroom instruction and supplemental intervention services. It does not apply only to students who qualify for special education. As she said, all students are often tier 1. It does not allow students to wallow in failure until they meet a qualification score. It doesn't focus more on compliance to forms and procedures than on student results. It does promote procedures that get the right services to the right students at the first signs of trouble. It doesn't ignore the bias of assessment instruments that over-identify students who lack prior knowledge due to the environmental and cultural differences that are easily misinterpreted as a learning disability, and it does not simply refer, test, and label students when they underperform in general education classrooms without proving that the problem is not the fault of the curriculum or the instruction.